Okay, let's unpack this. You know that friend who always knows exactly what you need, anticipates your next move, and somehow keeps everything running smoothly.
Hmm.
Often that's a nurse. Today, we're taking a deep dive into a profession that's, well, utterly vital, surprisingly dynamic, and built on centuries of dedication.
Absolutely.
You've handed us a stack of fascinating articles, research, and your own notes, and we're using them as our compass, to navigate the incredible, often unseen evolution of nursing.
And our mission today, really, is to cut through the noise. We want to extract those critical nuggets of knowledge that show how this highly demanded and incredibly trusted profession actually came to be.
Right.
We'll trace its historical foundations and hopefully really appreciate its expansive modern scope. You're going to uncover some surprising facts, I
I
think,
bet.
and see how today's nurses meet our evolving health needs with this powerful blend of science-based knowledge and unwavering compassionate care.
So let's kick off this journey then. When we talk about the history of nursing, it's easy to jump straight to Florence Nightingale.
Yeah, everyone does.
But our sources reveal something far more ancient, don't they? Where do these roots truly begin?
They go way, way back. I mean, imagine ancient tribal cultures.
Yeah.
Well-being was often linked to spiritual forces, right?
All right.
So care for the ill was sort of intertwined with rituals, healers using plants, efforts to appease what they thought were evil spirits.
Huh.
And with death being so common, care was often, well, palliative, really, by necessity.
Yeah.
But what's truly remarkable is finding early evidence of structured care as far back as 3000 BCE.
Wow, 3000 BCE.
Yeah, in Egyptian medical records. And then jump forward to the Roman Empire, around 300 CE. We see the first real attempts at building organized hospitals across the region.
Okay.
They were staffed by both men and women, carrying alongside physicians. It was a real foundational shift, from the purely spiritual to something more organized, more community level.
That's a massive shift. But then we move into the Middle Ages, and the immense influence of the Catholic Church really reshapes that landscape, doesn't it? Transforms healthcare again. How did that play out?
Well, the church became the dominant force, certainly in Western society. And healthcare really centered around religious institutions then.
Okay.
This is when the hospice emerged.
Hospice.
Yeah, like HOSPs.
Yeah.
These were the precursors to our modern hospitals set up in and around churches, religious communities. They primarily served the destitute, the poor,
Okay.
and were largely staffed by men. Women, though revered as caregivers in the home, found their public roles pretty restricted, often limited to midwives or wet nurses.
Right.
And if they stepped outside those boundaries, they risked being condemned as witches.
Seriously.
Yeah. And interestingly, during the Crusades, the church even established these exclusively male military nursing orders. The Knights Hospitallers are the most famous,
Yes.
dedicated to caring for the poor, pilgrims, travelers. So it shows this fascinating dichotomy,
Yeah.
sacred care, but highly gender segregated.
So predominantly male caregivers in this religious context.
Yeah.
Then the Renaissance comes along, this growing interest in science, enlightenment. But our sources suggest this era also brought a pretty stark division in healthcare. Quite grim, actually, especially along economic lines.
That's exactly right. As scientific inquiry blossomed, access to healthcare became a stark reflection of your wealth. If you were affluent, you could afford private nursing care,
Okay.
though often those nurses juggled caregiving with other housekeeping duties, that kind of thing.
Right.
But the poor, they were relegated to these notoriously filthy hospitals and almshouses, places starved of resources.
Oh, wow.
And here, care was tragically often provided by prisoners or elderly prostitutes. This really cemented the idea that nursing was a role for only those of, quote, low moral character.
That's off.
It was a devastating reality. Most people who entered these institutions didn't survive, so they became known as places people just went to die. A truly dark chapter for the profession.
Yeah, absolutely grim. And amidst that darkness, though, there's an often overlooked yet incredibly powerful chapter that emerges in the New World. The impact of slavery on healthcare access was devastating, obviously, but it also reveals these stories of just extraordinary resilience and selflessness.
Absolutely. I mean, think about the plight of enslaved people in the New World. Formal healthcare was basically non-existent for them.
Right.
Yet within this oppression, figures like Jane Minor just shine so brightly. There's an 1825 Virginia deed. It's just incredible to read it. Documents her emancipation.
Emancipation for nursing.
Yes. Her enslaver, Benjamin Harrison, freed her for, and I'm quoting here, several acts of extraordinary merit in nursing, at the imminent risk to her own health and safety, exercising the most unexampled patience and attention in watching over the sick beds of several individuals of this town.
Wow. That's powerful.
Isn't it? And G. Minor didn't just survive, she went on to earn a living as a healthcare provider for 33 years. And with her earnings, she purchased the freedom of many other enslaved people.
That's incredible.
Her story is it's a testament not just to courage, but to the power of one individual to create these ripples of freedom and care.
What an amazing legacy. Okay, so let's fast forward a bit. The 19th century, Industrial Revolution, crowded cities, disease-ridden neighborhoods.
Yeah, the perfect storm, really.
And this sets the stage for that truly pivotal figure, the one often called the mother of modern nursing.
This is where Florence Nightingale steps in. Truly the progenitor of modern nursing, as you say. And she's such an unlikely hero, right?
How so?
Born into a wealthy British family, at a time when women of her social standing were actively discouraged from having vocations.
Right. Expected to marry well.
Exactly. But Nightingale defied convention. She pursued her passion, studied nursing in Germany. Her big call to action came in 1854, Crimean War.
Okay.
She arrived at Scutari, Turkey, and found just appalling conditions. The legged, injured soldiers living in filth and squalor.
Hard to imagine.
And her response wasn't just, compassionate care. It was a methodical, data-driven transformation. She established clean, nurturing conditions.
And the impact.
Dramatic.
Mm-hmm.
The mortality rate dropped from a staggering 50%
Gee.
to just 2.2%.
Wow. That's radical and immediate impact.
It really was. And her tireless work, often tending to soldiers through the night by lamplight, earned her that iconic title, the Lady with the Lamp.
Mm-hmm.
But what's truly genius about Nightingale, beyond the empathy, was her embrace of data.
Ah, the statistician.
Yes, she wasn't just observing, she was meticulously quantifying suffering. Her record-keeping showed irrefutable proof that simple hygiene, good nutrition, skilled nursing care, they slashed death rates.
So it wasn't just intuition.
No, it was science.
Yeah.
This was the birth of evidence-based practice. It
Yeah.
forced this entirely new scientific lens onto patient care, a concept that's still, surprisingly hard won in healthcare sometimes.
Yeah.
Her return to England as a hero led to the Nightingale School of Nursing at St. Thomas's Hospital. Considered the first truly formal professional school, it fundamentally changed nursing from, a menial task to an honorable, educated profession.
So Nightingale didn't just open the door. She basically laid the entire foundation for a new approach.
Pretty much, yeah.
Yeah. But as you said, many other incredible individuals built upon her legacy, often facing immense obstacles, breaking new ground, particularly in the United States.
Oh, absolutely. Think about Clara Barton.
Right, the Red Cross founder.
Exactly. Despite having no formal nursing education, her dedication during the Civil War was legendary. She cared for wounded soldiers, often used her own money for supplies.
Wow.
Later, inspired by the International Red Cross model, she founded the American Red Cross. It just shows how individual dedication can spark these global humanitarian movements. It's fascinating.
It really is. And as formal nursing education, inspired by Nightingale, began to spread, who championed its growth across the U.S. and even beyond.
That would be Linda Richards. She became the first graduate of formal nursing education in the U.S. back in 1873 from the New England Hospital for Women and Children.
Okay.
But she wasn't content with just her own education. She then went on to pioneer formal nursing education in Japan.
No kidding.
Yeah, truly extending that critical knowledge globally, establishing nursing as this international professional discipline.
And crucial steps towards diversity in the profession started happening too, challenging those systemic barriers of the time.
Precisely. Mary Mahoney really stands out here. After working as a janitor, took 1879.
And she was.
The first formally educated black nurse. Her journey is just such a powerful testament to challenging these deeply entrenched systemic barriers.
Absolutely. It's clear these individuals weren't just practicing nursing, they were actively redefining it. What connects them? Is it resilience or maybe fighting against persistent societal challenges?
I think a really strong thread is advocacy for the underserved, driven by this deep sense of social justice. Take Dorothea Dix.
Okay.
She was a teacher, served as superintendent of Army nurses during the Civil War. But beyond that, she became this tireless campaigner, pushed for formal nursing education, indigenous rights, and crucially, mental health care reform. Really broad societal change.
And that advocacy for community health, taking care directly to those in need, that must have profoundly changed things for the most vulnerable.
Oh, absolutely. That's Lillian Wald. She's considered the founder of community health nursing. She even coined the term public health nurse.
Mhm.
In the late 1800s, she saw the mistreatment of orphans, the squalid conditions for poor immigrants in New York, and she established the Henry Street Settlement.
The Henry Street Settlement, right.
Her core belief was pretty radical for the time. Everyone was entitled to reasonable health care, regardless of gender, income, race, or age.
That's still a struggle today.
It is. The settlement focused mostly on women and children, dramatically improved health in the area, and amazingly, it continues its vital work today.
Wow.
Wald was also instrumental in creating the role of the school nurse, another huge contribution.
We see that spirit continuing, right? Bringing care to underserved communities, tackling specific health needs.
Definitely. In the 1920s, you have Mary Breckinridge, a nurse midwife who established the Frontier Nursing Service.
In Appalachia.
Exactly.
Mhm.
Serving the impoverished people there, primarily eastern Kentucky,
Mm.
she famously traveled on horseback to homes that were otherwise inaccessible.
Incredible dedication.
And her work significantly reduced infant and maternal mortality there. Then there's Margaret Sanger, tirelessly advocating for birth control, founding the organization that eventually became Planned Parenthood, addressing critical women's health needs head-on.
It's clear the fight for access and equality just kept driving things forward, breaking down gender and racial barriers, opening doors for more inclusivity in nursing.
Indeed. The mid-20th century saw some really significant breakthroughs. 1955, Edward T. Lyon, second lieutenant, nurse anesthetist. He became the first male nurse commissioned into the Army Nurse Corps.
That's a huge step.
Monumental, opening doors for professionally trained male nurses in the military. Which, makes you ask, where do outdated biases still limit careers today?
Good question.
And Joe Hogan certainly challenged one. Late 70s denied admission to a nursing program because he was male.
Unbelievable.
He sued, based on the 14th Amendment's Equal Protection Clause. And in 1982, the court ruled in his favor. That ended gender discrimination in publicly funded nursing schools.
A massive victory for equity. And what about further representation, bringing more diverse voices into the profession?
Well, Eldora Murillo Road, in 1975, created the Hispanic Nurses Association, worked to attract more Hispanic people to nursing, support unique health issues in that community.
Important work.
She was deservedly named a living legend by the American Academy of Nursing in '94. Then, 1979, Hazel W. Brown, first black woman promoted to general in the U.S. military.
Wow, General.
Yep, and then appointed chief of the Army Nurse Corps. And then, 1992, Eddie Bernice Johnson, first nurse elected to Congress.
Right.
Also the first black woman in Congress to chair the House Transportation and Infrastructure Subcommittee. She's been a tireless advocate for STEM education for underserved minority students, improving healthcare access. These pioneers really show that relentless pursuit of a profession that truly reflects the diverse populations it serves.
So, after tracing this incredible, winding historical journey, what does it all mean for the nursing profession today? It's clearly a field of immense trust, critical demand, constant evolution.
Today's nursing professional, they truly stand on the shoulders of giants. I mean, really. They're in high demand, lots of options for career paths, educational flexibility. Nurses are consistently ranked among the most trusted professions, known for meeting the public's changing health needs with that blend of science-based knowledge and profoundly compassionate care.
That trust is key.
It is. And a core value is that unwavering commitment. Provide competent, safe care to diverse clients with integrity, honesty, compassion. Regardless of the nurse's personal feelings or beliefs, that trust is absolutely paramount.
And it's so clear that nursing today goes way beyond just the bedside. The roles are incredibly diverse, impactful. It's not just about healing, but shaping health systems, isn't it?
Oh, completely. It's this dynamic ecosystem of expertise. Nurses are care providers, yes, but also case managers, researchers, educators, leaders, managers, and crucial change agents.
Tell me more about some of those roles, like case manager.
Right. So the case manager isn't just, scheduling appointments. They're the central navigator in a patient's complex healthcare journey. They make sure every specialist, every treatment, every family concern is harmonized for the best outcome. It demands serious clinical savvy and amazing organizational skills.
That sounds vital.
It is. Or think about a nursing researcher. They're not just looking up facts. They're meticulously building the scientific foundation that turns guesswork into guaranteed best practices, constantly evolving how care is delivered based on evidence.
And change agents.
They see a need maybe for a more efficient cardiac monitor or a better way to discharge clients, and they proactively take action. They drive improvement from within the system.
Education is obviously a cornerstone, but it's not a single path, is it? Lifelong learning seems truly embedded in nursing.
Absolutely. The pathways are really diverse. You've got the LPN, licensed practical nurse, typically a one-year program, works under supervision. Then the ADN, Associate Degree in Nursing. That's a two-year path, often designed to meet nursing shortage demands quickly.
Right.
The BSN, Bachelor of Science in Nursing, is a four-year degree. That broadens competencies into research, leadership, community health, policy.
More comprehensive.
Exactly. Then for advanced practice, there's the MSN, Master of Science in Nursing. The DNP, Doctor of Nursing Practice, prepares advanced practice nurses for leadership in really complex clinical settings. And finally, the PhD, Doctor of Philosophy. That's a terminal research-focused degree, heavy on evidence-based analysis, statistics, research.
And they use simulation now too, right?
Oh yeah, simulation is crucial. Using these high-fidelity mannequins allows students to practice skills, communicate, collaborate, make mistakes, all in a safe, controlled environment before they encounter real patients. It's a huge part of modern training.
So beyond the degrees, what really defines excellent nursing practice and protects clients day to day, what are those key competencies and professional standards?
These are absolutely fundamental. You have advocacy, supporting and representing clients' interests, making sure their wishes are heard.
Crucial.
Collaboration, working jointly with other healthcare professionals. It's a team sport. Communication, exchanging information effectively. That builds understanding, safety, trust.
Makes sense.
And change management, the skill of effectively introducing and managing change in a healthcare setting to improve care and processes. We also talk about 5 stages of competency.
From beginner to?
From novice new nurses, maybe struggling a bit with judgment, all the way to expert funk. Those nurses with extensive experience, self-confidence, almost an intuitive sense of a situation. It's a real progression of wisdom and skill.
And to maintain integrity and quality across such a vital profession, you need oversight. Ethical guidelines, those must be critical.
They're the bedrock, truly.
Yeah.
The Nurse Practice Act, those are the state-specific rules and regulations guiding nursing care.
Okay.
Then the scope and standards of practice, these outline competency statements for care and professionalism. And crucially, the Code of Ethics for nurses.
What does that cover?
It identifies the behaviors, the practices nurses should abide by to provide quality, ethical care. It's about maintaining human dignity, protecting client rights, privacy, confidentiality.
And who sets these standards?
Organizations like the American Nurses Association, the ANA, are central. They created the Code of Ethics, they set standards, they issue position statements on tricky issues like social media use or staffing levels, pay.
Can you give an example of the code in action?
Sure. Say a nurse observes a colleague exhibiting mood swings, maybe isolating themselves, frequently volunteering to administer narcotics.
Oh.
Right. The Code of Ethics dictates reporting those observations to a nurse manager. Not to gossip, but to initiate a fitness for duty assessment. It's about protecting clients and advocating for the potentially impaired nurse to get help.
That makes sense. Protecting everyone involved. And Florence Nightingale's legacy, that evidence-based practice, it really does continue to shape everything today, doesn't it? It's right at the heart of modern nursing.
It absolutely is. Evidence-based practice just means delivering care procedures, assessments, interventions that is supported by solid scientific research, showing it's factually accurate and effective.
So patients get the best care.
Exactly. It assures clients receive the best possible care. Nurses stay informed by constantly reading scholarly articles, integrating the most current, valid information. It's a direct line from Nightingale, you know. Her meticulous data collection connecting unclean conditions to infection laid the groundwork for this whole approach. It's about being both compassionate and rigorously scientific.
Okay, finally, let's look at the modern landscape. What are some of the biggest trends and issues defining nursing right now, and what opportunities do they present?
Well, there are several critical trends. The nursing shortage is a huge one.
We hear about that a lot.
We do. And it's positive to see more nurses furthering their education, often becoming educators themselves, which directly helps mitigate those shortages in the long run.
Right. Train more nurses?
Exactly. Then there's the ongoing opioid epidemic. Nurses are absolutely on the front lines, not just administering meds, but often being the first to identify addiction, manage withdrawal, provide compassionate counseling, bridging that gap between clinical treatment and social support in really tough circumstances.
And health literacy, I imagine that's a huge factor too, empowering patients.
It's vital.
Yeah.
Nurses are increasingly responsible for educating clients, helping them understand their health, empowering them to take action for themselves. Then there's the whole world of technology. specifically smartphones, social media, and clinical settings.
Double-edged sword.
Totally. Undeniable benefits, quick access to drug info apps, showing education videos, calling for help with a patient transfer, but also significant dangers,
Right.
like inappropriately sharing client photos, even of a wound, without proper consent, or sending personal texts from the patient's room. It blurs professional boundaries, risks privacy. Big ethical minefield.
Yeah, I can see that.
And we also see these broader initiatives like the U.S. Office of Disease Prevention and Health Promotion's Healthy People campaign, setting these science-based 10-year national goals to improve health for all Americans. Nurses are absolutely key to achieving those goals.
So, wrapping this up, what does this all mean for you, our listener? It's just so clear that nursing is this dynamic, incredibly complex profession built on these extraordinary historical foundations, but continuously evolving.
Indeed. Nurses today, they stand on the tireless efforts of everyone who came before them. The profession really requires this unique blend of science, compassionate care, critical thinking, all essential in our constantly changing healthcare world.
So, here's a final thought for you to ponder. Considering all the rapid changes, AI, data analytics, personalized medicine, what do you think will be the next major game changer in nursing over the coming decades? And how might those past innovations like Nightingale's data focus or Wald's community approach inform how we adopt it ethically and effectively?
Yeah, I just encourage you to reflect on the immense impact one dedicated individual or a collective effort can have. It's a powerful reminder, isn't it, of the lasting influence of advocacy, innovation, and just unwavering care in healthcare.
Thank you so much for joining us on this deep dive into the fascinating world of nursing. We hope you're leaving with a maybe renewed or even new appreciation for this incredible profession.